Many thanks for staying with us. For more on our top stories and others, please visit our website. It's channelstv.com and on youtube.com/channelsweb. Log on to m.channelstv.com to watch us on your mobile device or download the Channels TV app for Android, iOS and Windows devices from their respective stores. The Channels TV and Channels 24 app will give you access to news and updates. You also have the eyewitness feature with which you can share those pictures, videos or news of happenings around you. Just install the app, then tap and swipe to reveal the menu and follow the instructions. To agriculture now, the Cross River State government has resolved to begin the exportation of a branded banana to Europe and Southeast Asia. This is coming from Governor Ben Ayade while receiving a South Korean delegation in the government house, Calabar, the state capital.
Whether they're cooked, fried, eaten raw, or even brewed for beer, banana remains a staple fruit for most Nigerians. And the Cross River State Governor, Senator Ben Ayade, is looking to make great dividends from the arable crop. Sitting on a hefty 250 hectares of land, this is the banana farm in Odupani local government area of Cross River State. Banana, the state government believes, holds great opportunities for the states locally and internationally.
But when we bring the entire 1,000 hectares we are anticipating here, you can multiply it yourself and see the number of persons we are going to employ. So it's a big project, and even for the 250 hectares, we are aiming to realize about 600 million in food production. And it will take only about 8 more months here, you will get the first harvest from this field. And we're beginning to look at the market potentials of Nigeria. We're identifying the market chains and the supermarkets that will buy our banana already.
For the governor, agriculture means big business for Cross River State, and this is just another opportunity to demonstrate that.
Banana for export is very critical for us because banana is a very, very host-specific crop. It grows only on specific subtropical humid climate with black soil. That specific requirements to be lowland, humid, tropical, you hardly will find this. You only find in South America and a bit of Nigeria, basically Cross River and Enugu State.
The success of this initiative could be put to test in as little as 8 months when the farm is expected to yield its first harvest.
Still on agriculture, but this time in Ogun State, where farmers can now hire farm implements at lower rates to boost food production using modern methods of farming. That's according to the permanent secretary in the State Ministry of Agriculture, who says the initiative will encourage young farmers to go into agriculture.
The objective of this center is to make farming very close to the people. Instead of people coming to the center to come and take their equipment and their facilities, government and the World Bank are supporting a program called Vadama 3, whereby equipment house is built, whereby equipment and implements are built at highly subsidized rates, but again with contribution with the owner, so that they will know very little contribution from the beneficiaries, so that this implement can be made very, very close to farmer at highly subsidized price. Today, people within the Remo area can come to this center, hire equipment, till their land, plant their crops, and we want food everywhere in Ogun State. We can feed ourselves, feed the nation, and feed the whole world if possible.
From agriculture to health matters, a lot of Nigerians were stunned when they heard about the outbreak of monkeypox in Bayelsa State, south Nigeria. Now, chickenpox would have been more familiar. A lot of people had heard about that, but monkeypox was quite strange to a lot of Nigerians here. And to discuss ways to prevent this disease, we're being joined on the program by a Dr. Oluwakemi Odukoya, a public health physician from the Department of Community Health and Primary Care at the Lagos State University Teaching Hospital, LUTH. Thank you so much for joining us on the program.
Thank you. You're welcome.
Practitioners say there is no known cure for monkeypox disease, but why is this so?
Well, monkeypox is a disease that's not very common. It's a viral disease. It's a disease that's similar to smallpox, We don't have a vaccine and we don't have a treatment for monkeypox. However, there are things that we can do to limit the spread of monkeypox and make sure that as few people as possible get infected.
So tell us about those things we can do.
Yes. Now, first of all, we need to understand how monkeypox is transmitted. It's primarily a disease of animals. That's why it has the name monkeypox. But it's not just monkeys. It's monkeys, rats, rabbits, and some other wild animals. Monkeypox is primarily spread through contact with infected animals, either monkeys, rats, or the other animals that I mentioned. And it could be from eating improperly cooked meat from these animals. Those who slaughter such animals, primarily those who prepare bushmeat, are also at risk. And people who have such animals in their vicinity, so personal hygiene and environmental sanitation is also important. But aside from that, there's also human-to-human transmission. So when an animal infects a human being, that human being can infect another human being, and that's usually the reason why we're very concerned. So how is it transmitted from humans to humans? By contact with infected individuals, which could be any kind of close contact, because it can be through respiratory droppings, it can be contact with infected things that people have touched, and other kinds of contact with people that are infected. So if we want to talk about prevention, how can we prevent monkeypox? The first thing is personal hygiene. Hand washing is very important. We need to make sure that we wash our hands as often as we can, particularly when in contact with people that are suspected to have monkeypox. If someone does have monkeypox, because the signs are similar to malaria, it's fever, general body pain, initially, then there's a rash. It's a unique rash, primarily on the face and the hands, but all over the body. And people that have this rash are able to transmit the infection to other people. So if anyone has any signs and symptoms that resemble monkeypox, it's important to report that case immediately to the nearest health facility, such that such people can be taken to appropriate isolation facilities and stay.
The disease is relatively milder than smallpox and also non-lethal. Well, how long is the maximum span of the disease before it relieves the victim? How long is the maximum span of the disease before it relieves the victim?
Usually the disease doesn't last more than 3 weeks, most of the time. It's variable, but many times it doesn't last more than 3 weeks. Sometimes it's self-limiting. And even though we don't have a treatment, there's what we call symptomatic treatment, whereby in a health facility, the person can receive adequate care until the disease goes away on its own, because sometimes it goes away on its own.
So care, what would they be doing? Would they be properly hydrated?
Yes, the care we would provide would be hydration, analgesics, basically treating the symptoms till the human body is able to mount a response that can take care of the disease.
Now, it's in Bayelsa State. We had rumors about River State, but thankfully that was a hoax. But now it's in Akwa Ibom State. How do we prevent this disease from spreading any further?
That's a good question. Because of the way Nigeria is so intertwined and people travel around from place to place, that's something that we have to be very concerned about. When people are sick, it's advisable that they do not travel. As much as possible, we need to follow the basic principles of hand hygiene and respiratory etiquette. But if someone does develop a symptom, now this is not the time where people should go to maybe say a chemist or have some kind of self-medication. If anyone has anything that's like a fever or body pain, this is not the time to assume that it's malaria. This is the time to get to a hospital and make sure that you're checked to be sure that this is not monkeypox.
Thank you so much for sharing your thoughts with us, Dr. Oluwakemi Odukoya, a public health physician from the Department of Community and Healthcare from the Lagos University Teaching Hospital, Luth. And coming up after the break, the Nigerian Customs Services intensifies examination of all goods imported into the country. Do stay with us for the details.